Neck gaiters have been in the news because of a study that came out from a Duke group. And then those neck gaiters are that tube of fabric that people can wear around their neck and they can lift up to cover their mouth and nose. People like those because they don't have ear loops. They can kind of come up and down a little bit. But there was a study that came out of Duke University that was published. Really, the study was looking at a way to figure out how do we quantify how well masks work. And in this study, they used a laser and a camera and a computer algorithm to calculate the amount of droplets that came out from the wearer of a mask. And they compared that to a test subject, a person that had no mask on at all. And what they saw was that most of the masks decreased the amount of droplets compared to somebody that's not wearing a mask. But when the person had a neck gaiter, they actually saw more droplets in the air when that person was talking. And so the hypothesis is that the neck gaiter, actually the fabric, split some of those larger respiratory droplets into smaller respiratory droplets. Now, there isn't any clinical conclusions we can make from that, but it raises the question of whether or not these neck gaiters might allow large droplets to be split into smaller droplets that might be more readily transmitted to other people if that person were to be infected. I think the take home I get from that is that a neck gaiter still protects the wearer to some extent, and it's better again than having no mask at all. There's some question about how well it protects people around the wearer if the wearer of the gaiter were to be infected themselves. And so I think the gaiter can provide some protection. If they're just being worn for outside use, say during exercise, maybe that's okay. But if you're in an indoor environment, it's probably better to have a cotton mask that has 2 layers of fabric or some of these other masks that we've discussed.